What if the place you live was quietly shaping your health, your stress levels, your immune system, even your risk for chronic health, and you were never meant to notice? Hi, everyone, and welcome to Buried in the Blueprint, a podcast where we can uncover the hidden systems that shape Black health in ways that are often overlooked but felt deeply. My name is Imani Sene Jackson, and I'm a senior psychology student with a strong passion for community health, environmental justice, and understanding how structural inequalities affect Black communities. My work primarily focuses on how systemic factors shape both physical and mental health outcomes. Today, we're discussing an issue that is both invisible and urgent: how urban planning contributes to autoimmune diseases in predominantly Black spaces and Black neighborhoods. But before we begin, I'd like to introduce today's guest, my beautiful grandma. Can you share where you're from and
I'm
who
from
you
the
are?
South,
Okay. And who are you?
Sarah Logan.
And how are we related?
Uh, you're my only grandchild.
Mm. And what things are you passionate about, or what things do you like exploring?
History,
History? Why?
because a lot of stuff is hidden.
Mm. When we think about autoimmune diseases like lupus or rheumatoid arthritis, we often assume that they are purely biological or genetic. But research shows that our environment plays a major role in shaping these conditions. The presentation of this issue is to investigate how urban planning contributes to autoimmune disease risk in predominantly Black communities by creating environmental conditions that promote chronic stress and immune system dysregulation. It's important to recognize that health disparities in Black communities are not solely biological, they are structurally and environmentally determined. Poor urban design, environmental hazards, and systemic discrimination all increase disease risk. To better understand this, we can look at the work of Dr. Nancy Krieger, a social epidemiologist at Harvard University, whose research focuses on health inequities and the impact of systemic racism on public health. In her 2020 article, Discrimination, Segregation, and Health Inequities in Urban Communities, she explains that social inequities in health reflect embodied consequences of systemic discrimination. And that's a quote from page 43. This shows that racism and segregation don't just shape living conditions, they become physically embedded in the body over time. Similarly, James et al. In 2017 says, and I'm going to paraphrase this: a group of public health and environmental researchers examined how urban planning decisions contribute to health disparities. Their work highlights how Black communities are disproportionately exposed to pollution and environmental hazards due to planning decisions like highway placement and industrial zoning. These conditions increase vulnerability to chronic illness, including autoimmune diseases. Building on this, Dr. Patricia Coogan, an epidemiologist known for her research on chronic disease in Black populations, along with her colleagues, found a direct connection between neighborhood stress and immune health. In their 2020 study, they state that chronic exposure to neighborhood stressors may contribute to immune dysregulation and increased disease risk. And that is a quote from page 210. Together, this research reveals a powerful pattern. Social inequality doesn't just exist socially, it becomes biological. And that is quite fascinating. I want to start by asking what comes to mind when you hear that where someone lives can actually impact their immune system and risk for disease. Please share your thoughts.
They design the buildings in neighborhoods that they know are not safe, but they don't actually care.
Hmm. Hmm. And so, Grandma, you're saying that they don't actually care. Do you think that that has to do with any structural um, factors because of the government and the way they view Black people?
They know that the ground that they built certain buildings on, that the grounds was not safe. The water system there is not safe, and they just overlook it. It's all about money.
Hmm. And how do you feel about the highway placements or the way that trees or nature is planted or not planted in Black neighborhoods?
Uh, yes, because millions of people in the United States of America, they live in neighborhoods where there is no trees or there is no grass.
Hmm. Hmm.
And the only reason why I said that is because of New York and New Jersey. And when I came to California and I went to the zoo and I stepped on the grass and I go, ooh, and everybody was looking at me and I had to catch myself because
Hmm.
it felt like stepping on a soft bed or cotton.
Hmm.
See,
They do
they
know
know
what they're
exactly
doing.
what they're doing. That's like Marie said, she want to know what her father died from.
Because you think that it has something to do with the environment.
Mother Lee told me your mother's babysitter from Williamston, South Carolina, had been in Atlantic City, New Jersey for over 50 years. She came as a young woman. She said that that land where they built those homes for your grandfather was on a military dump ground. The same thing, 918A Drexel Avenue in Atlantic City, New Jersey. When they built those buildings, they built that on a bad soil. They tore all of that down and then turn around and build something else, more apartments on that same land.
Thank you for sharing that. Lived experiences like yours are powerful. How you were saying how when you lived in New Jersey, you saw in real time um, homes being built on former military sites, how they probably did not clean that. There's probably some chemicals that were still in the soil and the ground that people were breathing and led to them being sick. And that's important because for me, as a psychology student, this topic stands out to me because I've observed how drastically different environments can be, and some neighborhoods have access to clean air, green spaces, so supportive infrastructure, while others face pollution or overcrowding and limited resources. And those differences are not random. Grandma, I think that they are a result of systemic inequality. And research shows that long term exposure to environmental stressors increases inflammation in the body. And over time, this chronic stress can disrupt the immune system and contribute to autoimmune diseases. And as Coogan et al. In their 2020 article, they really emphasize that it's the accumulation of stressors in the body that places the body in a constant state of physiological strain. So, I would like to ask you, Grandma, what do you think needs to change to address these health problems and the health outcomes that are causing Black people to be facing pollution and overcrowding and limited resources more than our non-Black counterparts?
Well, at one time in the early 70s, and we're talking like 70, 69, 70, there was a law in South Jersey that if you got a girl and a boy, they couldn't sleep in the same room. You had to have two separate rooms for them to sleep in.
Mm-hmm.
That prevented overcrowding. And we're talking places for low income is what I'm getting at.
Mm-hmm.
And I was told this in early 71.
So you think that by overcrowding, you think that the way that low
I
income
think that
housing is built should
I,
be.
I I think yes, overcrowding. I think that has a lot to do with your mental health, and your health problems.
So you think that needs to change the way that low income buildings are spaced or planned or organized?
Exactly, exactly.
Mm,
If you have a family of five, there's a family of five. There needs to be three bedrooms.
hmm.
And see, they're not doing that.
No, that's really true. So I agree. Solutions must include urban planning reform, increased access to green spaces, and reducing environmental hazards in marginalized spaces is important. Policy level change is also essential. I agree with you. I feel like if you have a family of five, you should only have 3 kids, as that's essential. If these inequalities were created through systems, then they must be addressed at that same systemic level. And just as important is in community involvement. I agree, Grandma. We should be at these meetings to make sure that the voices of those affected are included in the decision making process. I have a question for you, Grandma. Do you feel like communities are currently given enough voice in shaping the environments they live in?
No,
Hmm.
they need to attend more city council meetings.
Hmm. Hmm. And why do you feel that way? And how do you think that'll make a difference?
That way, who they voted for, they can stand in front of and confront them and
Hmm.
see and make them do their jobs.
Hmm. Hmm.
A lot
Hmm.
of people vote for a person but never met the person.
Hmm.
They just say, "Oh, he's a good, or she's a good," but never went to the meetings to actually meet them and actually see for themselves. You can read people sometimes.
Hmm. Hmm. That's really true. So thank you so much for being a part of our podcast.
You're
We are
quite
going
welcome.
we are going to conclude, but what everything you said were critical points. What today's conversation makes clear is that urban planning is not just about infrastructure, it's about health. Autoimmune diseases, chronic stress, and environmental exposure are deeply connected, especially within Black communities where structural inequalities shape everyday living conditions. These disparities are not accidental. They are the result of systems that have long gone unexamined, but also means change is possible. We must advocate for equitable urban planning, environmental justice, and policies that center the health of historically marginalized communities because our environments should not harm us. They should support us and sustain us. Thank you so much for my guests and their time and perspective. And thank you for everyone listening. Stay aware, stay informed, and remember some of the most important truths about our health are still buried in the blueprint. Thank you so much and take care.